Welcome and thank you for joining us for today's webinar. I'm Mara Herman, Health Policy Specialist here at the Ecology Center, and I'll be your moderator for today's presentation. So here's our agenda for today's webinar. First things first, the webinar is being recorded. We'll be sharing materials along with the recording of the webinar tomorrow. So currently all attendees are in listen-only mode. If at any time during the webinar you have a question, please use the chat box to share it. After our presentation from Juanita Constible, we'll have time for questions. Our learning objectives for today are being able to identify ways in which climate change negatively affects health outcomes, and being to identify specific problems associated with climate change and health in Michigan and the Midwest region. I'm very excited to introduce our presenter for today. We are fortunate to be joined by Juanita Constible this afternoon. Juanita is the Senior Advocate, Climate and Health, Climate and Energy Program for the Natural Resources Defense Council. Juanita works with partners to advocate for strong federal and state action to cut carbon pollution and protect communities from the health effects of climate change. Prior to joining NRDC, Juanita oversaw the Science and Solutions Department at the Climate Reality Project and later served as an advisor to the Climate Action Campaign. She holds bachelor's and master's degrees in biology from the University of Victoria in Canada and a climate change and health certificate from the Yale School of Public Health. So with that, again, really excited to have her here today presenting for all of us. I'm going to turn it over to Juanita.
Thank you so much, Mara. I really appreciate it. Just let me share my screen real quick here. Great. So hello, everyone. Thank you for joining. I can't promise to be quite as interesting as the Mueller report, but I'm really looking forward to speaking with you today about climate change and health and looking forward to your questions at the end of the presentation. So I work in Washington, D.C., but I actually live in Virginia. And sometimes I joke that I work on climate change and health because I really, really hate Virginia summers. I mean, they're really pretty, but they're super hot and humid. And the nights don't really cool off. I grew up out west, and I'm used to, even in the hottest summer days, for the nights to get quite a bit cooler, so you get a break from summer heat. This is a graph of a temperature monitor at the Dulles International Airport, which is just 20 minutes from my house in Virginia. And it actually shows us that summer nights are getting worse in Virginia, not better. So over the last 4+ decades, the number of summer nights with minimum temperatures of 70 degrees or above have been increasing, even though there's this year-to-year up and down. So why does this matter to me? Well, I am a runner, and it's me in the middle, and this is some of my NRDC team after a charity race last year. Really hot and humid conditions impact race performance, but more to the point, I do my workouts early in the morning. And even though I'm trying to do that to escape the summer heat, I'm finding the mornings harder and harder to even want to get out the door. It's not uncommon for me to lose 2 to 3 pounds of water weight in just an hour workout. And while that's inconvenient and unpleasant, there's of course a health risk that's associated with that. I've actually come close to passing out a couple times after races because of heat and humidity. So the summers in Virginia being hotter and humid is no laughing matter. Heat is actually a really dangerous situation, as we'll talk about more. But there's a recent analysis that found that there are 5 different physiological mechanisms that can affect 7 different vital organs, including our brains, our intestine, our pancreas. So there's 27 unique ways that extreme heat can actually kill a person. And for people who work and play outside, that can be a serious matter. So my local experience is just one of the many manifestations of the present day effects of climate change. And if there's nothing else that you remember from this, it's that climate change is here and now, and it's affecting our health here and now. Of course, the more we pollute, the worse things will get. But this is not a future problem. It's one that your patients, the people in our communities, our friends and family are already experiencing, whether they recognize it or not. Before I talk about health outcomes, I just want to do a really quick review of why the climate is changing in the first place. So Earth is constantly emitting heat, and some of that heat escapes straight to space. But most of it is absorbed by pollutants from our buildings, our agricultural system, our cars, our factories that are called greenhouse gases. Carbon dioxide is the main one, but there are others as well. And importantly, the more greenhouse gases we put into the air, the more heat that gets trapped, because most of the heat that's radiated from the Earth is absorbed by greenhouse gases and then re-radiated within the atmosphere. One of the most important points to remember about climate change is that greenhouse gases can last in the atmosphere for hundreds to thousands of years. We'll come back to this a little bit later, but I wanted to raise it now. Within the US, transportation and electricity make up the bulk of our greenhouse gas emissions. Light-duty vehicles, so the cars and trucks that most of us drive around to get to work or play or school, account for almost 60% of the transportation emissions. This is a graphic of how much the United States has warmed in recent decades compared to the first part of the 20th century. So the cool colors are actually slight cooling. So you can see in small parts of the Southeast, there's been a net change in temperature towards the cooling direction. The pinks and the darker kind of salmon color are areas that have warmed. So most of the US has been warming, and some regions have been warming faster than others, including the northern states and parts of the Southwest. So you can see in Michigan in the lower right, the Upper Peninsula and northern part of Michigan have warmed faster than the rest of the state. This is a graphic that shows the projected temperature change relative to now, assuming a couple of different emission scenarios. So the panels on the right are the higher emission scenarios that reflect roughly the path that the world is on now. The ones on the left are an intermediate scenario. So if we made significant cuts in carbon pollution, that would put us on this lower path. And under the higher scenario, you can see much more warming, as you might expect, with the Midwest and the upper Great Plains in Alaska seeing warming of upwards of 8 degrees on average each year. Another physical manifestation of climate change is changes in extreme rainfall. So as the atmosphere warms up, it can hold a lot more water vapor, plus the rate of evaporation from streams and the ground and plants also increases. So even if there aren't overall increases in the total amount of precipitation, you can see increases in the heaviest rainfall events. So this particular map shows changes from 1958 to 2016 in the heaviest 1% of rainfall events in various regions of the country. And you can see that the Midwest and the Northeast have had the biggest changes. They're also among the regions that would see the biggest future changes. So again, on the left, we had the lower emission scenario, and big chunks of the country could see increases in the heaviest rainfall on the order of 20 to 25%. Under the higher scenario, the Midwest and the Northeast could see another 40% increase on top of what has already occurred. Now, of course, as you increase extreme rainfall, you get an increased risk of flooding, which can bring all sorts of health impacts, which I'll talk about in a little bit. So rather than going through all the many physical ways in which our climate is changing, I'd like to shift now to how human health is linked to weather and climate. Now, many people in the US and across the world don't really think about the connections of our health to climate or weather because we spend so much of our time indoors and often in very climate-controlled spaces. But there's a lot of direct and indirect ways in which weather and climate affect our health. So if you take temperature, for example, we already talked about some of the health risks of extreme heat. So there's that direct set of illnesses and potential fatalities like heat stroke, heat exhaustion, things that you're probably familiar with. What's less well known is that heat can also have a very direct impact on our mental health and well-being by affecting our cognition, our ability to process information, our mood, even our sleep patterns. And this is an emerging area of research that is revealing some interesting facts. And certainly as someone who doesn't like hot and humid conditions, I can attest to the mental well-being issue of being too hot. But then if you start looking at some of these other possible impacts, it gets much more complicated much faster. So for example, if you look here at this little tree, warming can increase the length of the pollen season and also make the pollen season start earlier, which affects people with asthma and allergies. Warming can also increase the time of year in which mosquitoes and ticks can be active and open up new areas of the country to ticks and mosquitoes where it used to be too cold for them to survive. We already talked a little bit about how warming can affect flooding patterns, and flooding can affect mental health. It can have all sorts of respiratory impacts. But then these health outcomes can actually interact with one another. So for example, there's been some recent work that finds that people who have pollen allergies are actually more susceptible to some depressive symptoms and other mental well-being issues. Likewise, if someone is taking medications for some mental health conditions, they can be more susceptible to the impacts of extreme heat because the medication interferes with their ability to regulate their own body temperature. So it's not a simple picture, but at the very basic level, we know that because there are so many possible pathways for climate change to affect our health, the bottom line is that it can affect anybody's health. Where it gets more severe is for people who have existing vulnerabilities and disparities that may be related to other things, like their race or ethnicity, their socioeconomic status, or other issues that make them more vulnerable to health impacts in general. So let's go through a few of those examples. So this is a picture of a trailer park that was damaged in Hurricane Irma. It's in Florida. And the reason I picked this picture is because there are a few largely housing or mobility challenges that are particularly problematic for people on lower or fixed incomes. For one thing, they may live in housing that's more susceptible to storm damage, or maybe don't have the money to evacuate or can't evacuate because they depend on an hourly job. And those things can all have repercussions for our health. You know, if someone isn't making money, they may not be able to pay for food and medication that they need. Also, there's been a lot of recent work that suggests that storm recovery efforts after a climate-sensitive event like Hurricane Irma actually favor people who are already wealthy or well-educated because they have the tools and the capacity and the time to seek the assistance that they need. So they end up getting the help, and the people who need it the most maybe don't. Race and ethnicity is another predisposing factor to some negative health outcomes associated with climate change. So let's take asthma, for example, which is a climate-sensitive disease in a number of ways. That's because a lot of triggers can be made worse by climate change. So allergenic pollen, wildfire smoke, mold after a hurricane or flood, and other environmental triggers can make asthma worse. Well, even without climate change, African American children tend to have worse outcomes for asthma than non-Hispanic white children. So these data are a little bit old, but nationally, African American kids are 4 times more likely to be admitted to hospital and 10 times more likely to die from asthma. Again, that's without climate change, but when you layer on worsening conditions onto this existing problem, it's likely that these kids will suffer the most. And then there are people who work in occupations that put them in harm's way when the rest of us are perhaps protected. This is a picture of a worker cleaning up debris after the campfire in California last year. And you can see this person is wearing a lot of protective clothing. Well, people who work in conditions like this, where they're wearing a lot of protective clothing, are more susceptible to heat-related illnesses because it's harder for them to cool off, and they're engaged in strenuous work. And there are plenty of other pathways by which people who work in certain jobs can be more affected by climate change. Take, for example, workers that are trying to shut down a chemical plant or some sort of industrial facility ahead of a storm. When storm conditions hit, often safety inspections get put on hold because there's so much else going on. So that puts workers like that at more risk of health outcomes that are not good. And then this is the last example I'll touch on in this section. Immigration status is another thing that can potentially amplify the health effects of climate change. Again, heat is a big problem for farm workers. They're actually the most likely to die in extreme heat than any other occupation in the US, followed closely by construction workers. And migrant workers who are not here legally or maybe have family members that have an uncertain immigration status, or there's some concern that they don't want to cross authorities, they may be less likely to report violations on the job or even to ask for medical attention if they're experiencing symptoms associated with heat or other climate sensitive issues, even though they're more likely to experience safety violations on the job. So let's talk more specifically now about Michigan. Much of the work in this next few slides comes from an issue brief that I led the production of earlier, that we just published a couple months ago, actually. It's on our website at this URL, and we have 3 other states there now: California, Colorado, and Virginia, and we'll be adding Pennsylvania and Illinois and possibly Washington State within the next few months. We also have a lot of other resources on our NRDC website. There are many pathways to get to it, but this bottom URL is probably the easiest way to find our materials. So this map shows heat exposure in Michigan from 2007, an average over 2007 to 2016, in terms of the number of extremely hot days by county. So based on historical records, we would expect locally defined extreme heat days to occur about 9 times a year every summer. But as the climate has warmed, the numbers of extreme heat days has increased. And in the darker orange and the red counties, we're seeing more extreme heat days than expected. That has a real cost in terms of our health. So from April to August in just 2016, Michigan emergency rooms reported about 4,000 visits for heat-related illness. One thing to keep in mind about statistics about heat-related illnesses and deaths is that they tend to be an underestimate, because often the cause of their visit is attributed to something else. So if someone has a heart attack because they were exposed to extreme heat, their medical records will likely indicate the heart attack, but not the predisposing heat in the first place. So there are many groups that are vulnerable to heat, but I want to touch on just a couple here. One is people with chronic illnesses like diabetes, and another is older adults. Both groups are more sensitive to heat, in part because of medications that they're taking. So I mentioned earlier about people taking some medications for mental illness. Medications, a lot of medications for chronic diseases can likewise interfere with people's ability to stay cool. And older adults are just biologically sensitive because their hearts and lungs may not be as strong as they used to be. And both of those organs and systems get really stressed during a high heat event, because they have to pump blood and make sure that they're engaged in keeping our bodies cool. So in a couple of studies that we found when we were working on the report found an increased odds of hospitalization and cardiovascular illnesses amongst these groups during extreme heat waves. And if you live in a city, you probably know that heat and smog often go together. So this is a screenshot of the air quality index on a day last July in the Detroit area. That day was about 6 degrees Fahrenheit above average, and the big red blob over Southfield shows where air was unhealthy for most groups. The orange and the yellow were less unhealthy, but still not great for really sensitive groups such as people with asthma or COPD. And because of where communities of color and low-income communities tend to be located within cities, they often tend to be exposed to the precursors of smog. So just a quick reminder, smog is mostly made out of ozone pollution, ground level ozone pollution. And it's formed when pollution from car tailpipes or other industrial sources combines with sunlight and heat and creates smog. So on really hot days, you tend to get more smog generation. Also, on stagnant days where there's not a lot of wind, smog tends to collect over areas. And a recent study found that in the Detroit metro area, there were more smog precursors, so more air pollution essentially, in zip codes with more Latino and low-income residents. I talked a little bit earlier about how increasing temperature can actually make it possible for ticks and mosquitoes to live in more places. And one thing that we're seeing in Michigan and in fact across much of the Midwest is an expansion in where black-legged ticks, which are one of the species that can carry Lyme disease, are found. So in 1996, there were 27 Michigan counties that had black-legged ticks. In 2016, that was up to 40 counties. Now, one caveat I want to mention here is that we don't know exactly how much of a role climate change plays in this spread versus other changes such as habitat and the expansion and increase of deer populations. So ticks hitch a ride on deer and then smaller mammals like mice. And as people build houses in wooded areas or as more reforestation happens, the ticks' preferred hosts of deer and mice can also expand. However, this is definitely consistent with what we would expect in a warming climate and with what several models have already suggested will happen. At the same time that ticks are expanding to new areas in Michigan, we're seeing an increase in Lyme disease cases. So this graph on the right is an annual number of cases of Lyme disease in Michigan from 2008 through 2017. And you can see the sort of ramp up in recent years. My caveat with this is that the data don't actually tell us where people contacted Lyme disease. So some of these Michiganders who were diagnosed in their home state could have actually caught it from a neighboring state. But again, it's a worrying trend. And our neighbors to the north in Canada are actually scrambling to try to get doctors ready to even diagnose Lyme disease because it's starting to spread in more places there because that we can firmly put at the feet of climate change. It's finally warm enough in some parts of Canada to support ticks. Oh, before I move off this, I've had Lyme disease 3 times, and I can tell you it is terrible and debilitating. I do not wish this on anyone. It is firmly tick season now, so please check the ticks. All right, moving on. So some of the vulnerable groups to tick-borne illnesses in Michigan and across the country are, for one thing, outdoor workers, which is probably not very surprising. I don't have Michigan data for this. But in North Carolina, a recent study looked at outdoor workers and found that 38% of the workers at baseline, so before the study even really started, had evidence of prior exposure to some kind of tick-borne illness. So even if they hadn't gotten really sick or even if they had only minor symptoms, over a third had been sick before. And then 26% of those workers got new infections during the study. So for forestry workers, landscapers, people who work in parks, who are going to be in areas of brush or tall grass, tick-borne illnesses and also mosquito-borne illnesses are a concern. What may be a little bit surprising is that wealthy white communities are also quite vulnerable to tick-borne illnesses. A recent study of 37 US states and the District of Columbia found that the incidence of tick-borne illnesses was higher in counties with more higher income white people and seasonally vacant housing. The authors aren't completely sure why this happened, but what they suggested is that, for one thing, it was a lifestyle thing. These people had suburban homes close to tree line, were spending more time in their yards, and they also had vacation homes that maybe weren't getting mowed, like the lawns weren't getting mowed on a regular basis, or there were mice that were kind of moving in while the homeowners were away. Now, I talked a little bit already, alluded to the fact that heavy rain and flooding can have multiple health effects. This is an area that actually needs a fair bit of research, where we know that there's probably problems, but there hasn't been a lot of quantification of who gets sick where and when and who's most vulnerable. So most deaths that are associated with heavy flooding come from drowning, as you might expect. That's particularly true during a hurricane. And a lot of people that drown during heavy floods, it happens in their cars. They're trying to drive across flooded roads that maybe seem safe and turn out not to be. Car crashes are also a problem during heavy rain, and the Midwest, I think, has some of the highest rates of car crashes during heavy rains in the country. And there's also a variety of other things, injuries associated with cleanup after a storm, more breeding populations for mosquitoes, possible exposure to toxic chemicals, mental health impacts, waterborne illnesses, and a variety of respiratory issues that can be associated with mold, again, chemicals in the water, and other things. So for example, this is a picture of an algal bloom in Lake St. Clair outside of Detroit. So the bright green is a big bloom of algae that live in the water. These algae are naturally occurring, but when they go into the supercharged mode of growing really fast in large numbers, they can be toxic to people and wildlife. They can have a variety of health effects, including gastrointestinal symptoms, skin infections, and among some populations, even respiratory outcomes. Now, historically in the Midwest, nutrient pollution from fertilizers or runoff from cities has been the main driver of algal blooms. But we're seeing that higher temperatures will make algae grow faster, and even in some cases favor more toxic species of algae than not. So not all algal blooms are toxic. This is a certain subset of algae. More heavy rain can also wash more of that fertilizer that I talked about and other waste into rivers and lakes. That can particularly happen in cities that have combined sewer systems. So Detroit, Port Huron, and a bunch of other cities in Michigan, and then about 860 cities across the US as a whole, have what are called combined sewer systems. So these are an old school way of conveying both sewage and stormwater out to disposal areas being our natural water bodies. And they were designed for a much different world, when population was smaller, when there was less urbanization overall. But now the systems are really outdated, they're often in disrepair, and we can get thousands of gallons of partially or not at all treated sewage dumped into lakes and rivers. This particular picture on the left is from DC, and you probably can't read the sign, but it's basically warning people, don't go in the water. Well, this is one of the areas that is ripe for more investigation by scientists, because there's a thought that they're very dangerous to our health, but unfortunately, because a lot of the symptoms can be mild, so maybe you have a mild case of what you think is food poisoning, you might not go to your doctor or report it. So there's this real reporting issue. We don't have a good sense of how many people get sick. However, there was a study done in Ohio which found that combined sewer overflows would increase the odds of emergency room visits for pediatric patients by 16%. So I've been regaling you with bad news. Let's switch gears a little bit and talk about how climate action is actually good for our health and often for our pocketbooks as well. So if you'll recall, when I was doing my brief overview of the greenhouse effect, I mentioned that greenhouse gases can stay in the atmosphere for hundreds to thousands of years. That basically means that the climate system is like this big old freight train that is barreling along, and it's really hard to stop it or slow it down, and it's certainly hard to make it change direction. That means that our future and the future of our children and their children depends on decisions that are made today. So to make big changes in the climate system in just even 20 or 30 years, unless we start acting now, people who are still alive during that period will suffer worse effects. That's also true when it comes to actions to prepare for impacts that we're already locked into. So because the greenhouse gases from 20 and 50 and 100 years ago, a lot of them are still up there, that means that we're locked into some climate impact. And preparing for, or attempting to address those issues, some of those interventions can take years or decades to implement, meaning, again, we need to get started now. So climate action really has two parts. It's about addressing the root causes of warming by cleaning up our transportation systems, our electricity systems, and other big polluters. And it means climate adaptation, which is basically learning how to survive and thrive in a changed climate. And we can save money and lives by doing both. So this graph was done by the Environmental Protection Agency for the 4th National Climate Assessment, which is a massive report that was released by the Trump administration late last year. And then subsequently, they tried to bury it by pretending like it wasn't a good report. Anyways, that massive peer-reviewed report found that as a whole, the nation can save billions of dollars by reducing emissions and undertaking adaptation. This is just the Midwest section and just part of the analysis. So it looks at the benefits of cutting emissions to health issues related to air quality and heat-related mortality. The bar on the left is the high emission scenario, and the bar in sort of pinky color and on the right is a moderate emission scenario. The point here is that we could save millions of dollars, and of course those are people's lives, not just the dollars associated with those lives, by making even moderate emission cuts. By making significant emission cuts, you can imagine that that pink bar would be even lower. One of the important things to know about this graph is that these projections do not include adaptation. Heat mortality is perfectly avoidable. It is not something that has to happen. And there are a bunch of different ways that health professionals can help make sure that their communities are safer from heat. These are just a few examples of things that can be done to protect people. So starting in the upper right, heat warnings are already put out by the National Weather Service and sometimes our apps on our phone. But there's work underway to figure out how to make those heat warnings more effective and to make sure they're actually getting into the hands of the people who are most sensitive. There's actually some really interesting work in Europe right now to try to find out how heat warnings could be specifically delivered to, say, long-term care facilities where there are a bunch of older adults that need particular care. Rest breaks at work and making sure people have access to hydration are also really important. One of the things NRDC is involved in is a push to get the Occupational Safety and Health Administration to establish a heat safety standard for indoor and outdoor work policymakers that would actually mandate rest breaks. Right now, there's nothing along those lines. There's sort of a general duty clause that kind of protects workers from heat, but it's not specific to heat. So we're pushing for stricter safety standards there. Public cooling facilities are a great way to give people a place to go, especially if they don't have access to air conditioning. One of the critical things about these is they have to be actually located where the people who need them most can get to them. So making sure that they're strategically located, that they're free, that they're accessible by public transportation if that's needed, will make sure that they're more protected. And then, of course, there's just ways to cool down streets by planting trees, using cool roofs, and other things. There's actually a brand new network called the Global Heat Health Information Network that's made up of scientists and decision makers. Pretty much anyone who's interested in joining can check it out. And one of the roles of this network is to share evidence-based ways to protect people from heat, because people are doing innovative work all over the world, but practitioners may not know about them where they are. So I encourage you to check that out. So reducing carbon dioxide and other carbon pollution definitely helps our health over the long term by minimizing future warming. But because greenhouse gas pollution comes from fossil fuels largely that have all sorts of other nasty things in them, like mercury or particulate pollution and that help form smog, by cleaning up those systems and taking action to minimize future warming, we're also providing opportunities to realize immediate health benefits. So for example, in Michigan, the transportation system is actually the state's second largest source of climate changing pollution. And this is unfortunately not a picture of Michigan, apologies. By providing people with a lot of different transportation options that are cleaner, we can reduce air pollution, which means fewer premature deaths, higher birth weights. It also means we get people more active, and that can also lead to lower obesity rates and better health. Paramedics can actually get to people who need them faster. And then there's just less stress associated with terrible commutes, like my terrible commute from Northern Virginia to the District of Columbia. Another co-benefit of climate action is that it can help make healthcare and other health necessities, put them in reach and for people who are currently having to choose between food and fuel. So one of the easiest and fastest ways to reduce emissions is through energy efficiency measures. That can be as simple as changing a light bulb, but it also means better appliances, more insulation in homes, better industrial processes that don't use so much energy. So we can still do the same things that we want to do, just using less electricity. Typically, an electricity bill that you get at home is charging you a bunch of fees, but then it's charging you a rate based on how much electricity you use. So if you're using less, you're paying less. And in Michigan, the Clean, Renewable, and Energy Efficiency Act, which was passed in 2008, I believe, has already saved people $3.3 billion in net savings on their bills. That's a big deal for people who are on a limited income. So this graph shows the median energy burden in the 48 largest states or cities in the US. So the energy burden is the percent of a gross household income that's spent on energy utilities. So when you look at all households in these 48 largest cities, you see an energy burden of about 3.8%. High-income people have an even lower energy burden because they have a larger income. For low-income households and households of color, the energy burden tends to be higher. Now, this report was done in conjunction with the American Council for an Energy Efficient Economy and Energy Efficiency for All, they've also done a more recent look at rural areas and see a similar pattern, that low-income households and households of color tend to have a higher energy burden. So the red dots on this show where Detroit is compared to the other cities. Well, if you reduce that energy burden through energy efficiency, you can help people afford to run their air conditioning or make other choices that can protect their health. So energy efficiency can help with temperature control and moisture control, which can reduce asthma symptoms and also free up cash for healthcare or other essentials. Michigan is making good progress, well, some progress, on clean energy and climate policies, but definitely more needs to be done. This is a look at how just carbon dioxide from the electricity sector has decreased in Michigan over the last couple of decades. So it's about a 19-20% decrease. Unfortunately, some of that has come from a switch from coal to natural gas. So both coal and natural gas are fossil fuels, but when you burn natural gas, it releases less carbon dioxide than coal. So as natural gas becomes a larger share of electricity generation in Michigan, you still see carbon dioxide emissions come down. What this graph doesn't capture is the fact that natural gas is made mostly out of methane, which is also a greenhouse gas, and in fact is much more powerful at warming than carbon dioxide is. Plus, by switching from coal to natural gas, utilities across the state are essentially locking in decades more of using climate unfriendly fossil fuels versus cleaner energy sources like wind and solar. The good news is that Michigan has recently joined the U.S. Climate Alliance, which was established in 2017 in response to President Trump's announcement that the United States planned to withdraw from the Paris Climate Agreement, an international climate agreement where all the nations in the world committed to cut emissions. This alliance has been steadily gathering states, and since Michigan's announcement just in early February, Nevada, Maine, and Wisconsin have also joined. So now the alliance includes 23 different states and covers 36% of the country's greenhouse gas emissions. And they have committed to cut emissions further, to keep the US on a path to meet the commitments of the Paris Agreement, even if the country ultimately decides to fully pull out, and also take actions to protect people now from climate change. One last piece of progress I would point out is that Michigan is one of the few states in the country that's partially funded by the U.S. Centers for Disease Control and Prevention to produce a climate and health adaptation plan. So this is all about making sure that Michigan's Department of Health and Human Services is ready to protect people from the impacts of climate change that are already locked in through a variety of preventative measures and interventions that are specifically designed to help the most vulnerable among us. This is always going to be a work in progress, and one of the things that's happening right now is that the general high-level strategic plan elements are being turned into implementable projects. So, as health professionals, what can you do to help make a difference? Well, I tell this to everyone whenever my friends or family say, what's the biggest thing I can do to fight climate change? I say, vote, talk to your lawmakers, and engage in as many civic actions as you can. I'm not talking about demonstrations necessarily, but actually engaging with the political and regulatory process. We all have a role to play in reducing our individual carbon footprints, but to really get to the change that we need system change. You know, it's all very well to say to someone, I think you should ride your bike more and drive your car less, but if there are no bike lanes or other safe ways for someone to use their bike, they don't actually have that choice available to them. So getting involved at a much bigger level helps create the systems that will support the personal actions that we want to and should be making. This is our Get Involved page on the NRDC.org website. And of course, I would love for your help with NRDC actions, but I also wanted to point out that there are multiple organizations that have cropped up or have recently reshifted their work a little bit to specifically lift up the voices of public health and other health interested individuals and organizations. So the U.S. Climate and Health Alliance, the Alliance of Nurses for Healthy Environments, Physicians for Social Responsibility, and the Medical Society Consortium on Climate Change and Health are just a few examples of, places where you can sign up to be a health champion. They'll send you action alerts or give you opportunities to speak to lawmakers, to write letters to the editor, engage in public comment periods, and all the ways that there are to be involved. Health professionals have a particularly important role to play in this field because, for one thing, you're trusted messengers. Nurses, I think, are regularly ranked amongst the most trusted occupations on any topic in the United States. But it's true that people generally trust their medical professionals. The other thing is many of you may be seeing people firsthand or who are grappling with the health impacts of climate change. Your personal stories of what you're seeing in your practices or your communities are really vital to help people understand what's going on. Along those lines, climate change is not exactly a very popular topic for most people. This graphic is from the Yale Program for Climate Change and Health, and the cool colors represent people who hardly ever talk about climate change, at least occasionally. You'll see that they're all cool colors on this particular map. And if we zoomed out to the US, you would see that most counties in the US, people just don't talk about climate change very often. But if we don't talk about it, we're not going to work on fighting it. And so I would urge you all to have conversations, even just as uncomfortable as they can be, with your family around the dinner table or your friends, to get them thinking about it and putting this higher up on their priority list. Another way, more specific way that you can be helpful is to engage in local and regional planning. So right now, the state of Michigan is putting together its next long-range transportation plan. So this is going to be everything from things like, where do we put more roads, or should we build more roads in this area, to how do we make sure the transportation system as a whole puts out less carbon pollution? How do we make sure that people have better commutes? What kind of public transportation do we want? It's quite a wide-ranging exercise. And right now, the state is in a very early stage, meaning that you can weigh in on what your vision is for Michigan's transportation system. Then there will be multiple opportunities throughout the next year to tweak the plan and to make it better. This is an opportunity for both climate adaptation and for reducing pollution. So on the adaptation side, for example, earlier I talked about how critical it is for cooling centers to be near where people can actually get to them. If public transportation systems are set up to make sure that people have more access, more reliable access, and faster access, then they're more likely to get to the cooling centers that they need if that's a necessity. The last thing, I've talked a couple times about how more research is needed in this area. And actually, NRDC is going to be hiring an early career scientist soon. The job posting isn't up yet, but will be at this website sometime in the next week, I'm hoping. We're hiring a climate change and worker health science fellow to do some investigation about the occupational health threats of climate change, dive more deeply into an area that's only barely understood. But there are plenty of other opportunities to do research, and I highly recommend, if you're interested in that, to pursue some of those. So that is it from me. I and welcome your questions now, or you should feel free to email me at jconstable@nrdc.org. I'm also on Twitter, and I'll just put in a plug that next week I'll be tweeting from the National Adaptation Forum in Madison, Wisconsin, where there will be a lot of conversation about climate change and health and how to keep people safe in a warmer, wilder, and crazier climate. Thank you.
Wonderful. Thanks so much, Juanita. And folks, just so you know, you are able to type out your questions into the chat box. But Juanita, to get us started, you just kind of were talking a little bit about discussing climate change with others. What's one way or a couple different ways that you kind of help keep yourself from feeling overwhelmed from such a large issue like climate change, and how are you able to help others who might be feeling overwhelmed, or making it sound like it is something that we can actually take action on and it's not something that's just taking over everything?
Yeah, that's a really excellent question, and one that I think a lot of climate activists like myself grapple with. To many of us, this is the most important thing of all things. And we have to start by recognizing that that's just not the case for everyone. So typically I approach the topic with friends and family by starting with just the weather. Often people will notice, oh, it's been extra hot, or it's been really stormy, or hey, I saw this terrible story about a hurricane. That's a starting point, but you really have to listen to where people are. So how are they talking about the topic? Are they expressing concern, or just sort of making conversation? Finding also just shared interests that can be affected by climate change is another way. So thankfully, I belong to a running club, and there's been multiple avenues to start talking about this. So for example, a couple years ago, we extended the period in the year during the summer where we would start our runs earlier in the morning to try and beat the heat. So we used to at Labor Day move our weekend runs from 7 a.m. to 8 a.m. And now we do that all through October. We keep them at 7 a.m. because it's just too hot in October. That's a natural opening for me to start talking about it and pointing people to something really concrete that they can do. You know, maybe it's a particular, maybe it's as simple as an action alert on a website. Maybe it's a public meeting that you happen to know about. Giving someone something tangible and then coming back to them and saying, hey, this is how your input or how everyone's input helps make a difference, really adds up. So it's celebrating those small victories and not trying to solve the whole thing at once.
Those are excellent tips. Thanks. Another question is, so here in Michigan, we have not been seeing or having to deal with the large extreme weather events like we have been seeing in other areas of the U.S.
Mm-hmm.
What are some great ways to still be able to show that there is a high level of urgency and need for action, even if we are not the ones who are experiencing the worst impacts currently?
Yeah, it's funny that you. It's not very funny. It's a little bit funny. A couple of years ago, there was actually a video a little animated video that Popular Science did, saying, you know, where should people move in 2100 under a changed climate? And they showed all these terrible things happening all over the country. And Michigan was the only place that didn't have terrible things. And so everyone, they said everyone should just move to Michigan. So I recognize that it's a more challenging story there. And, you know, honestly, it's challenging because the biggest concern for Michigan is probably going to be heat. And that's one of the harder things to focus on because it doesn't make good pictures. It doesn't swoop in this catastrophic way. But finding ways to point to how heat is changing how people are doing hobbies that they like, how it's affecting people's gardens, how it can be a real problem for the workforce. I recognize that that's not as spectacular, but it's important to make the case that there are fundamental ways that heat can disrupt Michigan that will just happen over a slower period of time unless there's action taken. I'm sorry, that's not a very satisfying answer.
No, that's really helpful. That was kind of what it was in reference to, because I was hearing it from a lot of people regarding, oh, I saw this video. It looks like Michigan's going to be doing A-OK. But you also have to take into consideration the fact that, okay, well, what about all the other areas of the U.S.? We're going to be having a lot of people coming here. We have to make sure that we have the structures in place.
Right. And one more thing I'd add is, of course, the Michigan economy doesn't happen in a vacuum. It relies on a lot of other states. And, most of the fresh fruits and vegetables in the United States come from California. So California's agricultural system is broken because they don't have water or they're constantly on fire. That affects food prices in Michigan, or it will eventually. That's another possible avenue to.
Great. So our next question is, what are some effective ways to keep the focus of the media and policymakers on climate change when they are really easily distracted by other issues that is perceived as more immediate?
This is not going to be a very sexy answer either. You have to keep telling them again and again and again and again. I mean, that's why I think that civic engagement is the most important thing anyone can do to fight climate change. It's about tweeting at them. It's about showing up in their offices. It's about making it a story that they can't ignore. And we've seen it work in some states where climate seemed like a non-starter. So for example, after Hurricane Matthew hit North Carolina last year, the North Carolina governor, who was not terribly interested in talking about climate change at all, put out an executive order and said, we're going to aim for a cleaner system and make North Carolina more resilient. So that big event was definitely what tipped him over the edge. But before that, it was local groups being in his face all the time saying, this is important, this is important, this is important. So yeah, it's persistence and being loud.
Yeah, and so kind of to go along with that, you mentioned earlier that you have done a few other state level reports regarding health and climate. What are some of the large concerns other regions of the U.S. Are currently experiencing or will be experiencing in the future?
Sure. So heat is a problem everywhere, but it's certainly a bigger problem in the areas that are warming the fastest and also that are least used to the heat. So this is actually part of the reason why heat is kind of a bigger deal in Michigan than it seems, is because people may not have air conditioning because they haven't needed it, or they're just physically not as acclimatized to the heat. So, but in places like the Southwest, particularly in California, some parts of that state are already on the edge of kind of livable temperatures. And so rising temperatures in parts of the desert Southwest will really make it challenging for people to do anything outside. Of course, water is a major issue in California. Just this year, they've finally been completely drought-free for the first time in 7 years. But the multi-year drought that was happening a few years ago was devastating to a lot of communities. One of the things that really stood out to me during my research on that particular issue brief is that communities in the San Joaquin Valley literally did not have water at their homes. They could not turn on the tap because their wells had run dry. And the state and nonprofit groups and municipal groups were trying to provide emergency water tanks and then would forget to fill them sometimes or just didn't get around to it. So people would not have water at their house for days. That to me is a harbinger of what much of the West could be facing under a more severe climate. In the Southeast, of course, hurricanes are a huge consideration, made worse by the fact that sea levels are rising and in some places quite fast. So in Louisiana, for example, not only are seas rising, but the land is sinking because of a variety of man-made changes to the landscape. So as a storm rolls in, the flooding that's caused by that storm can be catastrophic. It can go for hundreds of miles inland, as we saw during Katrina, certainly. So yeah, those are some of the big picture health concerns that have cropped up.
Got it. So another question is it worth engaging with folks that have intractable partisan views of climate change, or efforts that are focused on, voting officials out of office, and building support among those easily persuadable people?
Yeah, so I guess it depends on who the intractable person is. If it's someone close to you that you love, then it's always worth continuing to engage. When it comes to, so I can't get into electoral politics with my NRDC hat on. If anyone wants to reach out to me personally, I'd love to chat about the issue. But calling on lawmakers of both parties is critical, but definitely pick your battles. If someone has proven themselves completely unable to see the light, you're better off focusing on the persuadables in the middle. But certainly, who we have in office is critically important. I'm going to leave it there for now.
Okay. Yeah, I'm going to reiterate that. Currently wearing my Ecology Center hat, it is always beneficial to speak with everyone. And I mean, at the end of the day, climate change is something that impacts everyone, so it does have to be a nonpartisan issue.
That's right.
Another question that just came in: are there ways that health professionals can help NRDC collect data or otherwise assist with data reports?
Ooh, I'm very excited that you asked that question. Yes. So one of the things I'm actually working on right now is a report to look at the occupational health of climate change. This is related to the original research we'll be doing, but is going to precede that. I am really interested in hearing from workers who have experienced impacts themselves. So I'd encourage you to email me if you have such stories, because we want to try and not only use the data that are out there, but actually make this personal for people. In terms of more rigorous data collection, we're certainly interested in partnering with universities, with other research institutions. So again, if you have an idea, just drop me a line and we can talk about possible paths forward.
Great. So it looks like that's all the questions that have come through. We'll give it another minute just to see if folks have anything else. But if you're thinking of any last minute questions, I will pull up
here.
The next thing for us. So thank you again, Juanita, so much for your time today. We really appreciate you being willing to present for us. Next thing for us is evaluation. So our webinar evaluation is required for all current health leaders fellows. However, we also strongly encourage all other participants to complete the survey as well, as your feedback is valuable in planning future meetings. So I just sent out the survey evaluation in the chat box. You can find the link there. We'll also share it again when we send around the presentation. And then our next webinar is actually taking place next week. We'll be covering all things lead. We'll be joined by our very own Deputy Director, Rebecca Munich, and we'll be discussing lead health effects, contamination sources, and what you can do. The registration link for that will also be going out into the chat box. But again, I just really want to thank Juanita Constible for taking the time for presenting for us today. Like she said, if you have any other questions or want to get more involved, you can always reach out to her, or you can always reach out to myself and I can put you in contact with her. Thanks again for joining us today, and we will talk to you soon next week for our next webinar in the series.
Thanks, everyone.